The first week of the Affordable Care Act in action has been filled with confusion and some frustrations. People still aren't sure what they need to do to sign up for a policy, and those who do are finding glitches in the online process. So here to help clear up the confusion and help you bypass some of the roadblocks is local insurance expert Mark Matthews, the owner of MMA Insurance. Mark, it's a pleasure to have you back here. Hope you can answer some of these questions.
I'll do my best. Thank you.
So last year was the online, people could start to get online and check and see what kind of policies. Things haven't really gone according to plan, have they?
No, the website's not accessible. Nobody can get on. I think there's, how many people have registered is minimal at best. But we have ways around that.
And that's what's good. You don't have to necessarily go to that website in order to start looking for what you need. How can you help people, Mark?
We have relationships directly with the carrier, so we can go there.
Carriers meaning health insurance companies?
Health insurance companies, yes. Go there, get the rates, find out what it would be, and start getting the process going for you. It's free. That's what we do. The insurance companies pay us. So we're able to work your way through that. You don't necessarily have to go to the federal government's website to get registered.
And I think that's what people aren't understanding. They think in order to get a policy that is going to work for them, they have to go to that site in order to look for a policy.
Not true.
Not true.
Not true. We can help them get the same policy they'd have in place, just working with an agent that can help them understand the coverages, what their exposure is, what the deductible is, and what their real cost will be at the end.
If someone is watching this and says, okay, I'm going to call Mark and hopefully he can help guide me through this, where do you start with people and can you kind of step us through that process?
We're going to ask them what their goal is. What are they looking for? Are they looking for a basic plan? A more robust plan? What can they afford? What are their issues? Maybe the exchange isn't their best option. Maybe we could take them directly to the carrier with just an individual plan. We can look at how the subsidy works for them, how it does not, and then tailor-make a policy and coverage that fits what their goal is.
Your website is a good place for people to start, and maybe they may not realize what is required for them. Do you know the government requirements of what people need to have as far as coverage? And I think it starts January 1st of 14, right?
Correct. And you have all the way till December 15th to register for January 1st. So it's not a first come, first serve. We can get you on there, take our time, do it correctly, and get you in the right position.
I know for many uninsured people, cost is going to be a big factor for them. There are different options for people to choose from.
There are. There's actually 5 plans they could choose from that fit their budget, that fit their needs, that we can talk to them about, discuss what they want to achieve, and then make it work for them.
One of the good things, though, about people going forward under the Affordable Care Act is that if you haven't been able to get insurance before because of a previous illness or ailment, that won't be the case anymore. Explain how that's going to work, Mark.
Part of the Affordable Care Act is these carriers cannot exclude coverage for a pre-existing condition. So that's no longer the barrier, and it's been a barrier for a number of people to get health insurance, either to get it or to be able to afford it.
Right, right.
So now it's kind of a generic rating based on our age, and we can go through and you're going to pay irregardless of these prior conditions. Definitely will be a more affordable rate.
And when you're talking about options for people, you are talking about couples, singles, families. There's all kinds of different options depending on your situation?
Absolutely. There's really no barrier to someone to get insurance. They have opened the door for that. So in the past, if you couldn't afford it or you just simply couldn't get it, you will be able to get it. You
are asking people not to be afraid to reach out to you because, as you mentioned, your services are free. You can start to help people right now. They don't have to wait and get online with. I think that's really something we need to make sure people understand. They don't have to go through the government website, especially because it's not operating, yet they can still start to do things now.
They can make a patient educated decision. We can get the wheels rolling. You can call our office, we'll get your information, set up phone appointments, you could come in, talk to someone face to face. Many people do not know exactly what the co-pays are and what their exposure is, how much are they going to have to pay at the end of the year. We can help them understand how that works for them.
There's a lot to understand with this.
Many layers of health care, many layers.
And that way, when they come to you, they can talk to a person. I mean, that's even better than going online, even if it is a government website, because they can talk to somebody.
Yes. Ask questions, get answers. If we don't have the answers, we'll find out and let you know.
Mark, that's great. It's great information for our folks to know that. And they have until when to do this? December
15th if you want coverage to start on January 1st.
Mark, great. Thank you. Nice to have you here.
Thank you.